cute. It's post-strep. It's after strep. And I mean, not that you can't get glomerulonephritis without the strep, but this one is about strep. And it's inflammation of the glomeruli in the kidneys. It's literally in the name. Okay. So what happens in these kids that get post-strep glomerulonephritis? What happens to them? What do they look like? Well, first of all, they are they're going to have hypertension. This is one of the times they're going to have hypertension. They're going to have edema. This is post-strep. So this is a renal failure in a way with all those problems. Edema. Hypertension. Secondary to glomerulonephritis. So we're going to have to kind of, if we could fix the glomerulonephritis, we could fix the hypertension. There is hematuria. So blood in urine. Hematuria. So you're going to have bloody urine. They'll have that renal failure. They have damage to the glomeruli, which shows up with these symptoms. But when we're talking about the hematuria itself, it's not just bloody urine. We're talking about a different color. It is usually tea colored. Because if it was bleeding from the bladder, it would be bright red. But we're bleeding from the glomeruli, or the red blood cells are slipping through the glomeruli. And so it's older red blood cells up in the top where the kidneys are. So by the time they trickle into the bladder, they become tea colored. It's a bit brown or cola colored. Urine. They can have oliguria. Split this. I guess it's okay. It's not going to print well, though. Okay. So we just add more content, that's all. It's not like a comparison. It's just adding more stuff. So renal failure, edema, hypertension, hematuria, that's specific, tea-colored, cola-colored. They're going to have oliguria because we're going into renal failure, so they can stop urinating too. They are irritable. I mean, if you can't pee, you're going to be mad, irritable, and lethargic at the same time. Fatigue. Okay, and some other less common symptoms. Fever, it is an infection. Joint pain, rash are less common. Coughing. So B, and that's basically it. Those are the less common problems. Okay, so diagnostics-wise, we usually want to see if they have a history of strep. So we might do an ASO titer, which is an anti-streptogen O titer. So we're going to do a complete metabolic panel. We always have to. This is renal problems, right? For the actual diagnosis of if it's post-strep glomerulonephritis or not, we're going to do an ASO titer. And I'm going to add up here. I'll add it next. We're of course doing a CBC. So the CBC and the CMP is for, the renal problems, right? BUN, creat, if their electrolytes are off due to the renal failure part, and the CBC for any white blood cell count part. But the ASO titer is to definitively diagnose that this was caused by a streptococcal infection. And typically it is a group A beta hemolytic strep that causes glomerulonephritis, that can cause glomerulonephritis. There are other things that can cause glomerulonephritis, but we're focusing on this one. So GABS, or group A beta hemolytic strep, is the same strep that causes strep throat and that also can cause rheumatic fever. It can also cause scarlet fever and rheumatic heart and post-strep glomerulonephritis. That strep bacteria is nasty. It can cause a lot of problems, which is why we have a rapid strep test for when you do have a sore throat, and why we treat it so quickly with antibiotics, because it can cascade into other issues like infecting the heart, infecting the kidney, causing those issues. The rash isn't so much an issue. It's just a part of, if they come in with a sore throat and they have a sandpaper rash, it's immediately treated like a strep infection. It makes it a lot easier. I don't have to do a swab. I know it's a strep infection. But there are actually, strep can also infect the brain and cause pandas, which is very, very, very rare, but not impossible. So strep is nasty. We have to treat strep throat. Okay, so, but once diagnosed with post-strep glomerulonephritis, the strep infection's over. Usually it's been a couple of weeks. So now our goal is to treat and managing kidney function and the nephritis problem. Okay. All right. So that's diagnostics. Treatment. Is not complicated. Is preserving the kidney function, is managing symptoms of renal failure, like the edema. And hypertension. If we gotta fix the kidney, and these will fix themselves in the end. And possibly, depending on severity of kidney damage, we could have dialysis, which is hemodialysis, or peritoneal. Okay. How do we know they're better? Their renal failure is done. Any questions on glomerulonephritis? It's not, we used to compare this in pediatrics. We used to teach this and nephrotic syndrome. We actually had a patient at Hurley that probably does have nephrotic syndrome. But that's neither here nor there. But nephrotic syndrome is not a tested topic anymore. If you go look in the book and just peruse it for a second, there are major differences between nephrotic syndrome and glomerulonephritis. Glomerulonephritis is an infection, is usually post-streptococcal. Nephrotic syndrome actually is more immuno. Kidney failure is an immuno problem, which is why our patient was on a immunosuppressant, because that's why I think they have nephrotic syndrome. They have like classic symptoms of too much steroids and nephrotic syndrome. But they took nephrotic syndrome out of the EDAPs. So I will focus on acute post-strep glomerulonephritis But if you're curious, nephrotic syndrome is a specific renal pediatric disease that happens in pediatrics. Okay. Any questions on glomerulonephritis? It should have just been a bit of a review. Strep can hit any age, honestly. Any questions? Any questions about today at all? So everybody knows where to find the reviews for exam 1. I hope it's in, like, I think one of them is in week 3 files and one of them is in week 4. It's like right there. Look at weeks 1, 2, and 3. Do questions, library guides. Look at my quiz questions. Make an appointment if you want to talk about what you got on the quizzes. We can talk about the concepts there. If you find questions you don't know, please just ask me. I'm more than willing to help you. Tomorrow I am super busy, so if you have a dying question, just text me. I'm around. I'm just super busy with meetings with different students. So, but if in between times, I will text you back. No problems there. Just tell me who you are, though, and what you need. Because if I don't have your number saved, I don't know who you are. And random questions, just like, what's happening? So be clear in your questioning so I can answer you appropriately. Okay. This slide deck will be available in files in a minute. And remember, you can always add to it however you want. Instead of a worksheet today, I just did it in slides because I like pictures, and pictures are helpful for a lot of things, especially those gastrointestinal diseases. You just got to see them, and it makes a lot more sense. Oh, there was a video. Oh, shoot. Simple Nursing I'll add it to the PowerPoint. Simple Nursing has a video about rehydration that's really good. It's only a few minutes long. I'll add the hyperlink here in a minute. I have it. I'll add the hyperlink to the PowerPoint. It's actually in the I think it's in the handouts. Oh, I mean, these are good too. But random. There are some other little extra questions here if you want to see them. There's some case studies. Maybe I don't. Oh, here it is. There is a compare contrast nephrotic and acute glomerulonephritis. If you want to look at it. And what was I looking for? Helpful videos. Oh, maybe it's in a different section. I'll put it in the PowerPoint. It'll be fine. I'll just upload that. Any final questions today? No. All right. Have a wonderful lunch.
Professor Wong, sorry, I have a question.
Yeah, absolutely.
So I tried to schedule an appointment with you through Navigate 360 the same way that I